Hello, everyone. Tanishi, welcome to our webinar, Addressing Intimate Partner Violence in Saskatchewan, the Role of Second Stage Housing. My name is Emily Grafton. I'm an associate professor at the University of Regina, and I'm joining you from Treaty 4 territory. These are the traditional lands of the Nehiyawak, Anishinaabe, and Dakota, Lakota, and Nakota, and the homelands of the Métis and Michif nations. I am a citizen of the Métis Nation and a guest in these lands. I welcome all of the audience joining us virtually. Marzi Kekiao Awiak. I'm really grateful for us coming together today. I'm joined by my research partners, Dr. Amber Fletcher, professor at the University of Regina, Christa Giesbrecht, Director of Research at the Provincial Association of Transition Houses and Services of Saskatchewan, or PATHS, and Christa Barron, Executive Director of SOFIA House, which is an acronym for Support of Families in Affliction. We'd also like to give a shout out to our research assistants who have supported this project along the way. They include Bobo Doli, Adam Bugra, and Sarah Satar.
All right, so we'll begin by telling you about this research project and particularly why focus on this topic and why in Saskatchewan. So the reasons, the motivation for conducting this research project is that first and foremost in Saskatchewan, unfortunately, rates of gender-based violence are the highest among all of the provinces and are more than double the national rate. So violence, gender-based violence is high in Saskatchewan and it is disproportionate in Saskatchewan. The territories do show higher rates of gender-based violence than Saskatchewan, which is why we say amongst the provinces. But if we isolate the northern regions of the country, including northern Saskatchewan and other provinces with northern zones, then it turns out that Saskatchewan in the north has the highest rates of intimate partner violence, or IPV, in all of the country. We also wanted to conduct this research in partnership with a second stage shelter because we know from the research that gender-based violence is a significant cause of homelessness for women. If women leave a violent situation and have no stable housing to go to, they may be forced to either return to the violent situation or to become homeless. So neither of these, of course, are desirable or viable options. And so we know the importance of housing and second stage housing, which contributes significantly to supporting women who've left violent situations. Second stage shelters are shelters that support survivors as they transition from often an emergency situation, a crisis shelter, for example, to longer term, stable and safe housing where they can live independently. So we'll be hearing a lot about second stage shelters throughout the presentation today. And our research chose to focus on this because of the crucial and important link between housing access and affordability and availability and violence mitigation. Another reason to focus on gender-based violence and intimate partner violence in Saskatchewan is that until last year, 2023, Saskatchewan was one of only 2 provinces that did not fund its second stage housing. So unfortunately, this has led to higher problems for those who are leaving violent situations in Saskatchewan because it has reduced the capacity of those providing second stage shelter in the province. As of 2023, you'll notice the until 2023, last year there was a provincial announcement of funding in just over $870,000 for 5 different second stage shelters in Saskatchewan, 1 in Regina, 2 in Saskatoon, and also in Melfort and La Ronge. So we do see some progress. It's a 3-year pilot. To date, there have not been any announcements about the continuation of funding. That continuation of funding, stable, consistent support, is something that you'll hear as crucially important as a finding throughout this research project. So that's the issue.
So this project from the very get-go has been partner-led. In particular, our community partners, both SOFIA House and PATHS, have led the research team at the University of Regina. Now, the objective set forth by the community partners was to synthesize the knowledge on gender-based violence rates and support for second stage shelters across Canada. Our research questions include what kind of support for second stage housing exists across Canada, including legislation, policy, and provincial and territorial budgets, and what are the corresponding rates of gender-based violence in these jurisdictions. Our hope is that this knowledge synthesis project can inform or better efforts related to gender-based violence and second stage housing in Saskatchewan.
Our methods for conducting this research include an intersectional feminist framework, which really guided the entire project and the methodological design. For those of you not familiar with the term intersectional feminism, it basically refers to a form of feminist inquiry or analysis that considers how gender intersects or connects with other forms of social inequity and oppression, like race, age, socioeconomic status, etc., ability, for example, and to consider how these intersections of identity and power create very different experiences for different groups of people. And in this case, our focus was the experience of violence and seeking shelter. We also used a data feminism approach, which means using data for feminist questions, feminist research questions. So here we sought to look at how data can point us in the direction of identifying power issues, areas of inequity for certain groups of people, and situations where some groups are affected disproportionately to others, which my colleague, Dr. Grafton, will be talking about in just a few slides from now. We went about a very systematic review of different pieces of legislation, policy, budgets, budget documents, peer-reviewed scholarship, journal articles, etc. We also looked at industry reports, provincial reports, which I will be speaking about later, and media documents, all of which pertain to the issue of gender-based violence in Saskatchewan and housing, as well as specifically second stage shelters. We created, using a synthetic approach to bring together these different forms and sources of data, we produced graphs to illustrate the extent of the problem and the magnitude of the problem. We also conducted an in vivo analysis. In vivo is a software for data analysis. We collected 45 provincial gender-based violence plans and reports, looking for those that had a focus on second stage shelters. Not all of them did, but for those that did, we conducted a thematic analysis to look at how the issue of second stage shelters were being taken up, what kinds of information we could find about funding for those shelters, and to bring together pretty much anything that related to the situation for second stage shelters in those provincial plans. So I'll be sharing some of those results throughout the presentation today.
So let's turn to some of the statistical findings. We reviewed the existing data from Statistics Canada over roughly 2 decades to get a sense of rates of both GBV and IPV across Canada. Now, in this line graph, you can see Saskatchewan is represented by the top red line. Here, this graph demonstrates that in Canada, when looking at the national average of gender-based violence across the provinces, Saskatchewan does have the highest rates of such violence. Now, this next line graph isolates the data representing Saskatchewan against Canada. Here, we intend to illustrate how gender-based violence rates in Saskatchewan are roughly double the national average. Now, in this next graph, we've included the Canadian territories. And so you can see that Saskatchewan's red line actually becomes buried underneath the 3 territories. Indeed, Canada's territories have much higher rates of gender-based violence than that of Saskatchewan or anywhere else in Canada. Now, in this final bar graph, we compare the northern regions of Canada's provinces against the territories. Here you can see that northern Saskatchewan rates of GBV are higher than the northern regions of any other province, as well as the territories.
The findings of the literature review suggest that the high rates of IPV in Saskatchewan could be in part due to those funding constraints that I spoke about earlier, and to the limited amount of government funding that is specifically targeted to gender-based violence prevention and response, including funding for shelters. And as I noted previously, Saskatchewan is one of 2 Canadian provinces that lacks a gender-based violence action plan, which means that when we were collecting those provincial policy documents from across the country, Saskatchewan unfortunately stood out as not having a plan to address and respond to gender-based violence.
Now, the literature review also illuminated how gender-based violence disproportionately affects particular demographics. So the literature review is clear that Indigenous women are disproportionately impacted. Now, today, there's likely a public awareness of this disproportionate violence through the work of the inquiry into murdered and missing Indigenous women and girls and Two-Spirit people. We found this in the literature review, and in fact, our knowledge synthesis found that these disproportionate rates are tied to Saskatchewan's settler colonial context. We found that across Canada, there is a lack of political will and government urgency towards this settler colonial violence. We found that only 6 of the 14 jurisdictions have a plan to mitigate disproportionate violence against Indigenous women, and Saskatchewan is not one of those jurisdictions. Now, the MMIWG crisis is often noted as a double bind of sex and race discrimination. We found an extension of this double bind in the literature that demonstrates that racialized women, as well as newcomer women, face disproportionate rates of gender-based violence. Often these stats are related to language barriers or perhaps insufficient knowledge of Canadian laws, or even fear of deportation. We also found that women living with disabilities also experienced high rates of gender-based violence. And here I'll underscore the paucity of research on this particular intersection of gender violence and disability, especially concerning additional intersections of race or class or economic access. Finally, and related to each of these intersections of race, sex, and disability, the literature shows that in Saskatchewan, women living in rural, reserve, and northern locations face higher rates of GBV and lowered access to resources. Geography is a significant indicator of access or barrier to adequate resources. Now, our knowledge synthesis review also demonstrated that GBV is the leading cause of homelessness for women. 97% of women who have fled violence say affordable housing was always or sometimes hard to find in their community. Abuse and housing instability correlate. Women who experience IPV are 4 times more likely to be housing insecure. Yet housing is often portrayed as a gender-neutral issue. The literature argues that this presentation of neutrality obscures the inherent gender-based violence and homelessness connection. The interconnection of this violence and housing instability is exacerbated in Canada by the chronic underfunding of second-stage women's shelters. And here we note that numbers do not adequately reflect shelters' impact. Many shelters and advocates note that funders' quantitative assessment schemes look at the numbers. How many people came through the door? But a second-stage shelter offers a longer stay, and thus success cannot be quantified by a revolving door of visitors. Instead, success ought to be measured by the kinds of wraparound services an adequately funded system of second stage housing can provide. And this includes addressing the resulting physical, psychological, financial, and family-centered impacts of gender-based violence.
Our own qualitative analysis of the provincial policy documents, as I mentioned, used in vivo software to identify themes and also to add some quantification. Through the 45 provincial policy documents that we analyzed, we found that there is very strong rhetorical support for shelters and in some cases for second stage shelters, although unfortunately, even the majority of the policy documents did not mention second stage shelters. So there were many that did not include second stage shelters. For those that did, it was often expressions of support, acknowledgement of how important second stage shelters are. And in a lot of cases, the goal seemed to be to provide information about which second stage shelters exist and how survivors can access them. There was not, however, detail sufficient to allow us to see how funding had been allocated to those second stage shelters. And there was an absence of clear plans for what could be done to better support those shelters in the future. So where we saw a lot of rhetorical support, a lot of statements of support, it often wasn't supplemented or backed up by tangible action items and demarcation of funding specifically for those shelters. So unfortunately, there is a need for more specificity and more dedicated support for these organizations.
So we've summarized our conclusions to 3 high-level outcomes. First, there exists significant transparency issues regarding provincial budget allocations to second stage shelters. For example, differing jurisdictions use dissimilar terminology, or they make media announcements for funding that we found hard to track in budgets, or tracking multi-year funding across budgets and annual reports was further challenged as governments fall or funding just seemed to dissipate. Second, shelters' reporting capacity is affected by underfunding, which in turn affects grant writing success. Also, the requirements for reporting place stress on all programming, and this can shift staff time from service to reporting. Second, there's a lack of consistency in funding and reporting of funding across the jurisdictions. While it's clear different jurisdictions have different structures of financial or other kinds of support, the lack of consistency makes it impossible to quantitatively assess this landscape across Canada.
Consistency was also a big theme in our recommendations accordingly. So what you see here is just a selection. Our full report actually has many, many more recommendations based on this work. But some of the selected recommendations, I think, can really be summarized with the words consistency, stability, and also appropriateness, cultural safety. So starting at the national level, we suggest there needs to be consistency in the amounts of funding and the funding models, the way in which funding is provided to shelters so that there can be more consistent provision of services and spaces across the country. We also note that there may be potential to support this kind of consistency through national policy documents, national action plans. There is a national housing strategy, and there is a national action plan to end gender-based violence. But we suggest a national policy or plan that is focused specifically on shelters with attention to second stage shelters. There can also be more consistency, as Dr. Grafton talked about, in terms of data collection expectations, so that shelters aren't spending valuable resources collecting data to then obtain more resources, when in fact those resources could be provided to the people that need them, to the survivors. There's a need, of course, to harmonize our national laws and approaches with international commitments, like the Convention for the Elimination of Discrimination Against Women, or CEDAW, which takes a strong stance against violence against women and requires national governments to take action and to deal with this issue. As I mentioned before, cultural safety and appropriateness, there is a need for Indigenous guided and culturally appropriate gender-based violence services and supports, not pan-Indigenous, but specifically tailored and appropriate services and supports. Across all provinces, we suggest more attention to intersectional impacts. Which groups of women are disproportionately affected and why? making connections to structural causes like settler colonialism, as Emily pointed out, and paying attention to those differentiated needs, the nuances, and the context specificity in our policy and programming. In all provinces, trauma-informed and culturally appropriate services, again, which can be provided inside shelters, but also harmonized with those services outside of shelters as well. And again, consistency, stable, consistent operational funding that is not just a pilot, that is not just project funding, but ensures the ongoing operation and support for shelters that is so necessary, especially here in Saskatchewan. And here in Saskatchewan specifically, we recommend a provincial gender-based violence housing policy. That's something that commits to stable, consistent, again, those words, stability, consistency in funding, and also support for the important wraparound services that continue to provide shelters or shelter residents with those ongoing supports that they need. So that, again, this is just a sampling of our recommendations, and we look forward to hearing from our colleagues in the shelter movement about some of these findings as we move to Q&A. I would like to also just acknowledge the sources of funding for this project. We received funding for this synthesis project from the Social Sciences and Humanities Research Council of Canada, or SSHRC, and also Women and Gender Equality Canada, also known as WAGE. And again, to acknowledge our gratitude to our partners in this project, PATHS and SOFIA House, and also to our research assistants as well. So thank you very much.
Thank you, Amber. So this research was undertaken primarily throughout 2022 and 2023. And we'd like to shift to hearing from our partners to help us sort of animate the work that they do and also update a bit of that gap between the research that we did to present day. So we will start with Crystal. Crystal, can you please tell us about PATHS and your member agencies?
Yes, the Provincial Association of Transition Houses and Services of Saskatchewan is the member association for agencies that provide emergency shelter and counseling services to victims and survivors of intimate partner violence in Saskatchewan. We're a nonprofit organization and our office is in Regina, but we have a provincial focus. PATHS was formed in 1984 to serve as a collective voice for domestic violence shelters. We support our members by providing opportunities for peer support, engaging in collective advocacy and public education, and we also conduct research relating to intimate partner violence in Saskatchewan, and we deliver training for our member agencies and professionals, including legal professionals, and for various workplaces and organizations. PATHS members are located from Black Lake and La Ronge in the north to Swift Current and Estevan in the south. And those members include 17 emergency domestic violence shelters that provide short-term shelter for women survivors and their children, usually ranging from 3 to 6 weeks, though it can be longer. And as well as that residential support, our members offer a variety of other programming, including outreach support, cultural programming, and programming for children who've been exposed to violence. PATHS members also include 8 organizations that are not shelters, but offer community-based counseling and support for survivors of IPV. Some of our member agencies also offer programming for people who've used violence. And members include 7 second stage shelters that provide longer term safety and support for survivors and their children. And one of those members, of course, is SOFIA House. So I'll let Christa talk a bit more about the work that they do.
Yes, so that is our second question, is over to Christa to please tell us about SOFIA House, the services you provide, and a little bit more about the shelter itself.
Yeah, absolutely. So SOFIA House is a second stage shelter in Regina. At SOFIA House, we offer long-term housing and support for women, for gender diverse individuals, and for children who have experienced violence. We began in 1988. So SOFIA House was one of the first second stage facilities in Saskatchewan, and we have since expanded. We're currently offering combination of second and third stage housing. We have 39 total, 20 second stage suites and 19 third stage. So with the way SOFIA House is set up is our residents live in independent apartment style units. We work with those residents to provide both individual and group supports through women and children's programming. We have cultural and employment programs. We have a big focus on both harm reduction and cultural healing across all of our programs. And another interesting fact is SOFIA House in all 39 of our units is pet friendly. So individuals do not have to leave behind their furry friends to stay at SOFIA House. So really, as I think we've seen in the research, second stage shelters like SOFIA House play a really unique role in supporting survivors of gender-based violence. Emergency shelters are critical in providing that immediate safety and support in a short-term setting, but second stage shelters are really crucial for that long-term recovery that is needed when we're speaking about trauma. Most often, SOFIA House carries a wait list. So that often means that when individuals are looking to access housing from us, they have to go through a process of interview with one of our women's program coordinators. And that interview is done to determine additional information so that we're best able to support an individual. Ideally, we'd be able to house someone when they make that call to SOFIA House, but the reality is most often we are placing individuals on our wait list, and we are looking at finding additional community supports for them in the interim, or perhaps connecting them to a program that may be able to provide more immediate support. But ultimately, we are available to, discuss with any individuals on our wait list how we can best support them in that time frame.
Thank you so much, Christa. So this next question is for Crystal. Why are the problems of GBV and IPV so prevalent in Saskatchewan?
Yes, thanks for this. And this is a complex question and one that we get asked a lot and one that we think about a lot. So the graphs with the statistics in the presentation show the high rates of intimate partner violence in Saskatchewan. This is consistent, and year after year, we see our province having rates over double the national average. And that is not just for intimate partner violence, but also for intimate partner homicide and other forms of gender-based violence, including sexual assault. But there's no simple answer to why this is the case. There's a number of intersecting issues that can influence perpetrators' decisions to use violence, and victims and survivors' risk and barriers to ending the relationship or getting service and support. And one of these factors is the rural nature of our province. There's many different and complex barriers for people when they're experiencing violence and thinking about ending a relationship. But in a city, you have access often to specialized IPV and GBV services, easier perhaps to access housing, access second stage or emergency shelter, and get other supports. For people in rural areas, they often have to leave their community to get those supports. And that can mean leaving people that you're related to. For Indigenous communities, leaving access to your culture, to elders who speak your own language, and having sometimes to give up a rural lifestyle, moving away from employment, from animals, from farming, from other responsibilities. So all of that can really make it very complex for rural survivors and lead to people staying in situations where they're at risk for longer. And then, of course, the history of colonization in Canada and in Saskatchewan plays into reasons why people use violence. And again, reasons why someone may want to see their partner change, may want to stay in a relationship, may not want to leave their community as well. So all of that plays into some of that complexity. And then why does it keep happening? There's a relatively small number of programs for people who perpetrate intimate partner violence in Saskatchewan. So depending on the size of the community, there may be no program at all. There may be wait lists, or the program may not be a fit for the individual depending on language, culture, gender, sexual orientation, or the forms of violence and abuse used. And then we also have deeply ingrained attitudes held by many individuals and reinforced by families and communities. So we hear examples of survivors encountering attitudes that condone IPV when they reach out for help from people in their communities. Sometimes these attitudes reinforce to perpetrators that their behavior is acceptable. Children witness it, and it shapes the way they treat their partners in relationships. And it also impacts how people respond when someone close to them discloses that they're experiencing abuse. And also, when we look at the rates like were displayed on those graphs, we are looking at the rates of police reported intimate partner violence. So when IPV is reported to police, it's most often physical forms of violence, such as assault or sexual assault. Other offenses could be uttering threats or criminal harassment that could be in those police reported data. But coercive control, which is a pattern of degradation, controlling and regulating all of the victims' activities, isolating them, disallowing independent thinking and decision making, is currently not a criminal offense in Canada, though Canada is looking at implementing a criminal offense, as is currently the case in UK, Scotland, Ireland, and New South Wales, Australia. So while our member agencies, including SOFIA House, support victims and survivors of abuse, whether or not there has been criminal legal system involvement, victims and survivors of coercive control currently have little options in terms of legal mechanisms, such as protective orders that can keep them safe. And also, despite the connection demonstrated by research between coercive controlling behaviors and domestic homicide, there's little opportunity for perpetrators of that behavior to be referred to treatment or other risk management conditions. So I think that those factors as well can lead to survivors staying in situations where they're at risk because of the emotional manipulation and the fear, and because their options are severely constrained. And I raise this because I think advocating for a criminal offense of coercive control is important for safety for survivors, repercussions and interventions and support for people who use violence, and increased public awareness of intimate partner violence generally and coercive control specifically, but also because doing so would lead to better data and would show an even better picture of what the situation of IPV in Saskatchewan is.
Thank you, Crystal. Crystal already touched on some of the long-term recovery issues, broadly speaking, but I want to turn a similar question to Christa and hear from the second stage shelter perspective about any challenges that you experience in sustaining recovery long-term for survivors.
Yeah, and I think this is where it really ties back into the research that was done, because, as many shelters can probably attest, one of the key issues we face is, even with that funding announcement last spring, there is a lack of stable funding. So, that government support is limited, and this really makes us reliant on short-term grants, on donations from the community, and fundraising campaigns. That's really an unstable way to approach, being able to offer really comprehensive and wraparound supports for survivors. I think when I spoke about SOFIA House and what we do, touching on our wait list, that is a big concern, and that ties back into the high numbers of gender-based violence that we see. The impact is that we don't have enough to deal with the numbers that exist. And so that combined with the lack of stable operational funding really does lead to difficulties. Primarily the first one I can think of is staffing expenses and being able to compensate staff fairly and competitively, which, then leads to retention issues. So these are concerning factors in Sophia House and other second stage shelters' ability to be stable as an organization. But there's also an additional layer in addressing the intersectional needs of survivors. We're seeing a high level of mental health and substance abuse issues. Crystal touched on, some of the complex layers to the legal system and supporting survivors in coping with aspects of that. So that, in addition to the lack of stable funding to fairly compensate our staff, definitely contributes to our inability to ensure, we're providing trauma-informed counseling in a wraparound way so that survivors are best supported in their individual needs.
Wow, thank you, Christa. You sort of pulled in the fifth question there. So I don't know if you wanted to add anything there. You've already talked about some of the challenges as they pertain to the needs of survivors. How does Sophia House adapt its services to meet the changing needs of women and families over time?
Yeah, and I'm so fortunate. I haven't been with Sophia House a super long time, but what I do know is over the years, so much work has been done to adapt the way Sophia House offers its programs and supports to its residents. So, talking about those complex layers and the intersectional needs that our survivors have, our programs have been adapted to address mental health and substance use, built right into the work our women's program coordinators are doing. We certainly do our best to incorporate cultural sensitivity and cultural supports in an inclusive way, taking into consideration, the individual's desires and what, allowing them to direct what kind of cultural healing and what kind of cultural supports they would like to connect or reconnect to. As I mentioned earlier, we also have an employment program, and that piece is about connecting women to the opportunity to gain employment or go back into employment. It could also encompass pre-employment aspects such as resume writing or even applications to attend school. So really tying every aspect of our services into that intersectional need that our survivors have. I think over time, Sophia House has learned to be flexible and to adapt when we see these issues emerging or becoming very prevalent in our survivors' needs. And ultimately, it ensures a safe space so that our survivors can heal on that long-term timeline and work towards independent housing and a life that, is free of violence.
Thank you so much, Christa and Crystal, for those responses. They were really robust, and they really help us, as I said earlier, close that gap between the report and contemporary understandings of second stage housing, specifically within Saskatchewan. We are going to shift here and open the floor to the audience to see what kind of questions you might have for us. And you can put those questions in the chat. Well, while the audience thinks of questions, we have a few extra questions here that we've prepared. So why don't I ask this question to Christa? So, Christa, how does Sophia House ensure cultural sensitivity and inclusivity in its programs?
Yeah, so we build cultural programming, in sort of a group type format. So some of the different activities that we've offered just this year include things like sage picking, healing groups, berry picking, ribbon skirt making. So these are opportunities for our residents to gather sort of in a group type setting and have the opportunity to reconnect or connect to those aspects of their culture. Individually, that's usually very resident directed or resident led, in that access to different ceremonies, access to elders or spiritual supports is done based on the resident's direction. We also, our employment program was done with an Indigenous focus in mind. So while we offered it to all residents, the approach to our pre-employment program was done from an Indigenous lens. And we make sure that we keep culturally appropriate materials on hand. So, if residents are looking to smudge or access different medicines, that we are able to supply those here, in addition to the materials needed for some of those group programming. And then we also do our best to partner in the community with different Indigenous-led organizations, so that we are making sure we have those strong cultural connections and are able to then share that to our residents, whether it's through community events or a more individual focus.
Thank you so much, Christa. So we've had a few questions come through, and the first one goes to Christa. How many people does Sophia House currently support in their 39 locations?
So we have 39 individual apartments, not locations, but currently we are filling 2 more spots out of our 22nd stage. So right now we're at 18 in that program. Our 3rd stage program has just started to take off, and there are a few additional layers to that program where we need to work with our funder, the Avana Empowerment Fund. So in that program, we are currently supporting 2 individuals, but we have several more that we're working with to help them obtain housing in that program.
Thank you. So the next question says, your research is until 2021. Is that unfortunately the most recent data available? Good question. So the research that we conducted began at the end of 2022 and ran into till about June 2023. It was a knowledge synthesis. So it means it was collecting all of the existing research that we could find. When it came to the data from places like Statistics Canada, that was as recent as 2023. So we did a scan back of about 20 years or so to collect the data that we used. I hope that answers the question. And maybe I would open the floor to my colleagues to add anything.
Yeah, I can add a little something on that. So yeah, really it depends on, because we used a lot of national data from Statistics Canada for the synthesis. It really depends on the survey. Of course, we know the census is available every 5 years. So around 2027, we should be having some more brand new data from the 2026 census. So, census data, we're always looking at a significant time lag just because it's only done every 5 years. But of course, there are household surveys, Ministry of Justice surveys that are done annually. So some of the data is from 2021, especially the census data that you see in the full report, but some of the data will be from those more annual surveys. So in that case, it is newer. So really just depends on the source.
Thank you, Amber. So this next question I'm going to suggest is to Crystal or Christa. You two decide, or perhaps you both answer. It says, what can people in need do while they are waiting for shelters? Seek support from friends, family, etc.
Okay, I have a couple of thoughts, so I'll chime in and then see what Christa has to add. First of all, our member agencies, shelters, counseling services, and second stage shelters also offer support on an outreach basis and over the phone. So a list of all of those agencies in Saskatchewan is on PATH's website, which is pathsk.org, and there's a button that says Get Help Now, and it has a list of contact information for all of those agencies. So if someone is waiting to go to shelter, either because they're making a plan and they're getting things put in place for when it's a safe time to leave, or because unfortunately there's wait lists, because that can be the reality, they can get support in making a safety plan and figuring out what those next steps are, and just get counseling and information from those professionals over the phone. So that's always available. And also, I want to acknowledge the question about getting support from friends and family. And that's a very important piece of things too. Many people will always talk to a trusted person, whether it's a family member or a best friend or a coworker, or someone they know, before they decide, is this something that I want to engage formal service providers for? So family and friends and community members have a really important role to play. And that's why it's so important for all of us to be aware of what the services and supports are, so that we have some information to offer if someone discloses, or if someone says that they're experiencing violence or abuse, or thinking of getting out of a relationship. And also really important to keep working on this public awareness and education piece, so that when family and friends and other supports are approached, they give a response that is supportive and empathetic and understanding of the dynamics of violence and abuse. So I think that's something that really goes hand in hand with the discussion, is knowing that natural supports are such an important piece of prevention that needs to be a key focus for the awareness building.
Thank you, Crystal. I would just extend that question, followed by the next question, which is, how can churches help folks looking for support? Can they write letters to folks? Can they partner with people? What can they do?
Yeah, I can kind of speak to this and echoing what Crystal said. In terms of the public getting involved, whether that's a church or someone who, knows someone who is impacted by gender-based violence. As mentioned, there are, of course, opportunities in our community to educate yourself about these issues and to be able to provide that support, whether it's for one individual or, a group, sharing with people what is happening, current events, and arming yourself with that knowledge that we unfortunately do lead in these numbers. And, that's not a point of pride, but some of those more tangible ways to maybe get involved or to provide support. I will put that shameless plug out there. Donations, the financial kind, are what continue to make sure organizations like SOFIA House are able to sustain. It's an unstable funding arrangement that we do have. And so, if the capacity is there to make a financial contribution, then that's one of the most impactful ways to make that change. You're also able to get involved in fundraisers as a community-based organization. One of the ways we continue to ensure our stable funding or that we have funding accessible is through fundraisers. So, contacting SOFIA House and asking to get involved. Volunteering, we provide opportunities through safe means. Of course, anonymity and the confidentiality of our residents is really important, but we do provide opportunities for community members to, be vetted and get involved in supporting our shelter. And kind of a plug for paths, but I am aware that they provide materials that can help individuals be aware of the statistics in our province and advocate at the government level. So, we have a lot of political figures knocking on doors this time of year and wanting to speak to people. So, getting that information in hand and being able to share some of the statistics and the facts around gender-based violence in Saskatchewan is another way you can support.
Thank you very much, Christa. So the next question is, why has Saskatchewan not invested in programs that work with perpetrators of violence or prevention programs?
I don't think I have the answer to that or can speak to that for sure, but I think it's part of a pattern of not enough support and not enough consistent funding support across the board for this issue. So this work paths, as I said before, has been around for 40 years, and some of our member agencies opened their doors a few years before that. And so it's been this continual struggle to be able to get more shelters in Saskatchewan and fund them to an adequate and sustainable level. And I think then the piece about, okay, but what about the people who are causing the problem and who are doing the violence has sort of come along as well. But part of it too, I think, there's just that sort of motivation and support for the issue, but the rural nature of our province also poses a barrier, I think, because in many places in the province, if for someone who has perpetrated violence and is referred to a program, there might be nothing in their local community. So it's driving to an urban center to access that. And we have such small numbers sometimes as well, that then there can be wait lists and there can be delays to get into those programs. And this is a whole side issue, I think. But another issue too is that sometimes sentences expire and mandates to attend expire before individuals complete programming. I know that's not the question, but all of these things kind of relate, I think. And so there needs to be some consideration of how programming can be made available to individuals when they need it, promptly, as soon as possible after self-referral and acknowledgement of using violence, or after a court mandate to do so. Having that available and having it available to people where they live. And I think this is a question for future research and future investigation, but maybe how technology can be involved in making that more accessible. And needing, again, this is another problem with small population numbers and rural communities, but having options available so that they are a fit for people based on culture and gender and sexual orientation and other factors, because that will make programs, I think, more accessible and welcoming perhaps to people, but lead to people staying in the programs and completing them and hopefully having some more positive results.
Thank you so much for that response, Crystal. I will note to the audience that we are coming up to the end of our hour. We have about 5 minutes left, but your panel here is committed to staying and responding to all of the questions put forward. Of course, we do understand that some of you will have to jump off, but we are recording this if you miss any of the question and answer period. So let's turn to the next question, which probably goes to Christa, which is, how do you get a second stage housing off the ground, financially, politically, engaging the community? Oh, you're on mute? No? No. How about, Crystal, would you like to respond to the question?
Yeah, I'll jump in and say something, and hopefully that comes back, or our background tech support can figure that out. Thankfully, we're almost at the end of our hour, so you haven't had to miss any of Krista's other points. But I think there's the complexity of starting a second stage shelter is that there's the capital funding needed for the building. And so many shelters use an existing building, whether it's often was formerly a home. Sometimes they're large homes that then can be repurposed into a shelter space, or a new purpose-built shelter. So securing the area, the land, the building for that is one piece. And then the second piece is the ongoing funding needed for staff and for the operational costs. And that's a lot, because you have the transportation and the food and all of the daily needs for the families in the shelter, as well as all of your utilities and all of those pieces, and staffing. And Christa had talked before about the importance of that. So the need to establish the capital funding and do that sort of one-time piece is likely easier than the ongoing funding. And that is what we hope to see, is continued and increased government support for second stage shelters. So to have that consistent funding that is available. But many shelters, or all shelters really, including Sophia House, do top up that funding with a lot of fundraising and a lot of community support and donations. So that is some of it. But more practically, or more specifically as well, if anyone on the call is thinking about, well, how could you support or be involved with starting a second stage shelter in your province, you are welcome to reach out to us at PATHS. We don't have all the answers, and many of the shelters and services have been doing this for many years, but we definitely have resources in terms of our member agencies who do this work, shelters and second stages that have been formed more recently, who can tell you a little bit more about their experience. And we also have some thoughts on the ways to connect in terms of federal and provincial government partners, and how some of those funding pieces look.
I
Thank
hope I'm
you.
unmuted now.
Yes, you're back.
Great.
Okay.
Please,
Thank you.
please chime in on what I missed. Thank you.
Yeah, thank you for pinch hitting there. Apologies, I had a disconnection of some kind. I was just going to add as well that Women's Shelters Canada has a really great webinar series on how to get second stage housing off the ground. So I'm not positive how often that series comes around, but I would recommend getting on their email list. And that way, when they do offer it, it's a 3-part series. They have some great, real-time information around how to get those pieces that Crystal was talking about with capital funding campaigns, whether it's purchasing an existing building, whether it's building from the ground up. In Sophia House's case, we've partnered with a housing provider, so that supports the capital pieces on our end. And historically, prior to partnering with Havana, Sophia House was partnered with the Regina Housing Authority. So working through your local housing authority could also be an option to try and get something off the ground in that way.
Thank you so much. So the next question, there's 2 questions here actually. One from Joanne, who asks, how can people better ensure that governments are aware of the supports required for second stage shelters? Followed by Dolores, who expands that to the public and politicians. So can Crystal or Christa, or both of you, speak to how can people ensure that politicians and governments are more accountable?
Yeah, well, I think I go back to what I was saying before. PATHS is a really great resource, and connecting with them for some of those specific statistics around election time, like we are currently in, is, I think, important, because, being able to speak to political figures with the educated information, being armed with that piece is helpful. Advocacy, right? The more people talking about it, the more people letting the community know that this is a important and valuable contribution to supporting those who have experienced violence. is always going to be helpful. And yeah, so I would say making sure you're educating yourself with that information and that you're comfortable speaking to community representatives around those needs and advocating.
And I'll add to that, I think another way to demonstrate the need to our elected officials and to our policymakers is research like this. I think the work that Emily and Amber and the research assistants have done is really helpful because it puts together what's available in other jurisdictions, what's available here, and where some of the gaps in support are, but also the gaps in the knowledge and the data as you spoke about. I think that collecting that data is absolutely necessary for making the case for funding. And something that we do at Paths is conduct research here in Saskatchewan relating to intimate partner violence. And I think that research and those findings have been helpful as well for us, but for our member agencies and our partners to talk to government, to advocate to their local officials, and to talk about some of the issues that are important to them, armed with some data about what is happening here in our province. And now is the time of year as well where, you know, we'll be attending perhaps town halls and forums and having people on our doorsteps who are talking about their policy platforms. So it's a really great time to ask people who are involved in local politics about their thoughts on what to do about intimate partner and gender-based violence here in our province, and specifically support for domestic violence shelters and services, including Second Stage.
Thank you so much, Crystal. So the next question is, how should the government evaluate how much to invest in second stage housing versus affordable housing? How many times do women go back to their abusers because they can't find long-term housing after leaving transition houses?
Yeah, I think that's why research, as Crystal mentioned, is so valuable, because it helps provide that information, and it also supports the fact that a long-term stay and a long-term opportunity for recovering from violence is so crucial, and that we can't really put numbers or timeframes around what that looks like. You know, certainly we can give some estimates between 6 months to 2 years as some of the common themes we see in individual stays, but that's not individual to everyone. And so ensuring that we are able to provide the long-term support is, I think, crucial in that regard.
Thank you, Christa. Crystal, did you want to add anything to that?
No, I think Christa summed it up really well, so thanks.
Perfect. Okay, so the next question is, in the shelters or research, is there any evidence of a relationship between gender-based violence, intimate partner violence rather, and sex trafficking?
Yes, absolutely. So I can't speak to this from my own research in Saskatchewan, but we know that there is definitely a link, and our member agencies do support survivors of trafficking as well. And sometimes that's people who have been trafficked by, you know, someone who's sort of not an intimate partner, but oftentimes that coerced entry into sex work or into the sex trade is from a partner, and that can go very much hand in hand with intimate partner violence. So very important from a professional education perspective for intimate partner violence professionals to be aware of and know how to recognize trafficking and understand some of the dynamics and perhaps the differences and the impact on victims and survivors, and to be able to connect them with with additional specialized supports. But really important, I think, that organizations that focus on trafficking and organizations that work on intimate partner violence are communicating and are working in partnership, because there is so much overlap between those issues.
Thank you, Crystal. So there's a few other questions asking about how to access the research that we've talked about today and the webinar that Christa mentioned. The webinar, as Paths mentioned, thank you, is through the Women's Shelters Canada. And then Amber has provided a link to our published article in the Journal of Community Safety and Wellbeing. You can also find copies of the original report that we produced through both the websites of Sophia House and Paths. And that's it for questions. Can I offer the microphone to our community partners or Dr. Fletcher for any final comments?
I would just say thank you so much to Paths and Sophia House for partnering with us on this research. Could not have done it without you, and just kudos for the amazing things you do on this issue. Thank you.
Thank you very much. I will also echo that. And it's so important to us at Paths to have opportunities to do research, and importantly, when there is research, to communicate it to our member agencies and to the public. So we're really grateful to Dr. Grafton and Dr. Fletcher for undertaking this, and for their interest in second stage policy and improving things and making recommendations that are actionable for Saskatchewan. So very thankful for that, as well as for Sophia House and all of our member agencies for doing the important work on the ground and being part of making things better for victims and survivors. And to everyone who came to this webinar and is interested in this topic, just by having these discussions and knowing what's available and knowing what's happening, everyone is better informed and better prepared to do or say something helpful when someone close to you might be experiencing violence. So just showing up is, I think, a success, and thank you.
Yeah, and I mean, I first of all want to thank all of you for this opportunity to share and contribute. Research like this is so vital to the advocacy that Sophia House does, and to working towards that long-term sustainable supports that we can get at the government level. So I'm so appreciative that we have this information to work from, that we can share it in community, and you know, grateful to the community for as Crystal said, their interest, their support, and you know, just the opportunity to share the good work that Sophia House does, and in supporting survivors.
Well, thank you very much to the entire panel here. Thank you to the audience for giving us your time and for staying late for our questions. And thank you to Paths for the tech support. Couldn't do the webinar without you. Take care, everybody.